Why was I specifically told that bruising would not occur? When it did, the doctor simply stated, "That's very unusual." In minutes, the assistant noticed swelling in the lateral area of my left eye. She gave me an ice pack and told me to keep it applied for the next 20 to 30 minutes, which I did. The bruise appeared within 1 hour and worsened. I've had to suspend all my work appointments as a psychotherapist for 1 week and counting. I had specifically asked if bruising was a possibility, as this was my first Botox experience. I had come into the dermatologist for removal of a non-cancerous growth on my forehead.
Thank you for your question. You've submitted a photo and a question supporting the photo where you asked why were you told that bruising wouldn't occur, and then once you got a Botox injection at your dermatologist's office, which was done incidentally at the same time as when you were having a medical procedure for your forehead. And of course, you state that you developed swelling and a bruise that resulted in you having to change the way you were working because of your work as a psychoanalyst. Well, certainly I can help you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. And I've been treating patients with Botox since the early 90s. In fact, our specialty, oculofacial plastic surgery, were amongst the first physicians to use Botox for the treatment of medical conditions such as benign essential blepharospasm, and then naturally as the popularity of Botox in the cosmetic realm expanded to the way it is where it is today, certainly I've had tremendous experience in this area. So now the context in which you got this injection certainly raises some concerns. It's something that I hear a lot about when patients come to me. The challenge for people who go to a dermatologist, and I don't mean to disparage dermatologists in general, but there is a certain bit of a consistency in what I hear when I hear a question like this. A lot of times dermatologists are very, very busy. They have big practices, they see a lot of patients, and they bounce from room to room really, really fast. And in the interest of maximizing maybe the patient's convenience or introducing them to an aesthetic procedure, whatever the reason, the motivation, a lot of times I think that the consultations are a bit rushed. And I'll explain to you in contrast how we take care of patients in our practice and how sometimes this type of situation can be avoided. To begin with, let's start with just the possibility of a bruise. As a reminder, again, I'm a cosmetic oculofacial plastic surgeon. That means I trained in eye surgery and I did specialty training through the American Society of Ophthalmic Plastic Reconstructive Surgery of surgery around the eyes, the eyelids, the orbitolacrimal system. So I certainly know my way around eyes. And I can tell you I never guarantee to anybody that they won't bruise, no matter how good I am at delivering injections in this area. The reality is the eyelid area is vascular, and there's always a possibility. Very often when patients come to me, they'll be nice about the results I give them, and one of the things they'll say, "Oh, you're a very good doctor, you didn't give me a bruise." And honestly, it's not being a good doctor. Sometimes it's a combination, of course, of using the right type of instrumentation and a gentle touch, which is fine. But it doesn't mean I have the ability to see every capillary that runs through the delicate eyelid skin. And I do occasionally create bruises. So I think that what was the challenge here was there wasn't preparation for the possibility of a bruise. When I talk to patients about doing Botox or any injectable for the first time, I discuss the possibility of a bruise, and I ask what's their situation in the context of what they do. I explain that if they have to see patients, if they have to meet with people, if they have to speak in front of people, if they have to appear in media, then you don't want to do something where there's a risk of a bruise that can really impact how things are going in the other parts of your life. I think that what was not considered was this possibility, and of course Murphy's Law. You got a hematoma, or a local collection of blood, which eventually spread downward and makes you look like you're in some type of altercation. The bruise will, of course, clear up. I find that a lot of times women handle this a little bit more with greater facility because they're used to applying makeup, and maybe they're used to having these injections. When we talk about the risk of bruising, I'll say, yes, you can get a bruise, and a female patient may say, well, yes, I understand, but I'm pretty good at covering up with makeup. So there's a dialogue. And so I think that unfortunately your first experience with Botox was a negative experience. I would say that don't let this be the only experience for you, but in the future you may want to have this procedure done with the understanding that maybe you'll have a day or two off. A lot of times I tell my patients who work Monday through Friday that come to the office on a Friday, and that way you can try either, whether it's the first time or just for the sake of convenience, you'll have Saturday and Sunday in case you get a bruise. And it is rare to get a significant bruise like you have, but certainly this was not an emergency, and so I think a little discussion might have had some value before this. Now, of course, this is the assumption I'm making based on your question. I wasn't there during your consultation. So again, the risk of bruising is always a possibility anytime anyone enters the skin with the needle. And so that's something to be mindful of. But otherwise, Botox is the #1 non-surgical cosmetic procedure for a lot of good reasons. It's very effective, it's very useful, and makes people extremely happy. So hopefully you'll learn something from this experience, and you may want to discuss this with your dermatologist next time you see the doctor. So I hope that was helpful. I wish you the best of luck, and thank you for your question.